Dr. Lindsey here. I'd like to introduce this video to you. It covers a variety of topics. First off, it's a repair case with a guy that had poor scarring at 2 other clinics and who wanted FUE. And I agreed with him. I thought FUE would be a great choice for him. He's a really straight-haired, Asian, middle-aged health education professor who had done his research. And so we laid him down to do FUE, and it was easy to find the correct angle, but his hairs were just extremely fragile. We probably made 20 initial holes, and in removing the hair, we had almost no transections, but the hairs just fractured. Part of the root would be avulsed off, and so it just wasn't worth doing. And so we abandoned that and did a scar excision with a small amount of good hair included with the strip, and then a 3-layer tricuspid closure. So issue 1 is that this guy on the surface would appear to be a perfect candidate for FUE, but as I've said before, U stands for unpredictable in FUE. Next is he's an Asian guy, and Asians tend to scar worse than white people do, and he likes a really short haircut. And so you're taking a guy that's had 2 kind of crappy scars who wants a short haircut and taking out more skin and trying to get him a better scar. And there's no guarantee on that. But we did a 3-layer closure. You'll see in the video that his scalp pulled very wide open, but we were able to get him closed easily, and he wound up with a really good scar. Next is we're doing a crown case on a guy with very fine hair, and the crown is a doggone black hole that sucks up every graft that you put in it, and particularly fine hair. And so he had a few grafts kind of sprinkled around the back elsewhere, and that just that recipe never turns out well. And I think he had it done twice at 2 different clinics. I think one's a national clinic and one's a regional clinic, and it just was not enough hair. So we trimmed him down, and you can see in the pictures he's got a few grafts, but mostly just thin, kind of wispy hair. So we packed him out with all the hair that came out with his scar, and he showed up last week at 18 months out from surgery with a friend that he brought in to have a hair transplant, and he looks fantastic. Now, there's a couple limitations in his result. First is he has a very short haircut, and in crowns and in the front, layering is key. You know, hair transplant doctors cannot put it as dense as God puts the hair. And so even though we pack it as dense as we can, a little bit of layering of the hair, not comb over, but layering, helps camouflage a color mismatch between black hair and lighter skin. But he likes short hair. Next is in the crown, because hair angles out radially, unlike the front, you can just never have enough hair in the back. Take a look at a child that you have in your house, or that you see at your workplace, and have them look at the top of their head. And even little kids with straighter hair appear to have thin crowns just because the hair goes out in all different directions as compared to the front, with a little bit of layering, like a forest covers the skin behind the hairline. So he likes short hair, he doesn't layer, and he's got really fine Asian hair, and he's got a significant color mismatch, but we got a great result, and enjoy this video. So it's 18 months since we did this, right? Lean forward. And you wanted FUE, and I agreed with you. I thought you'd be the easiest guy in the world to do FUE on, with that straight, reasonably thick Asian hair. How could you not miss those? And the answer was, we didn't miss many of them, but your hair, in spite of it being looking pretty good, it just broke every time we pulled them out. And so we had to quit, and we did a strip on you. And I think I told you Asian guys typically scar worse than white guys do, but that's a pretty good scar. Not perfect, but good. And you have a pretty short haircut right there. And you're an educator. Chin up a little bit higher. And we did your crown. And I think I told you that in the crown's a black hole that sucks up every single hair. So we've got pretty good coverage. If your hair wasn't so doggone straight and it was a little wiry or bushier, it'd even be better. But it's pretty good. Anything you want to add to this, sir?
It's amazing. I'm very satisfied.
Perfect. And how much did it hurt overall?
On a scale of 1 to 10, it was probably a 5 or 6. It was manageable.
Perfect. All right, here's another view with indirect lighting in my office. That's pretty good. And you just reminded me something, which I didn't. You and Wendy reminded me that you'd had 2 cases before you got to me. And so I was the third guy in your head. And I guess I cut out your old strip scar, is that right?
That is correct.
Hold that hair up there, Wendy. Well, then I would change my story. Earlier I said it was a good but not perfect scar. If that's the third time in your Asian head, me cutting out 2 other scars, I'd say that's as good as it's ever going to get. That's perfect. And then when you bring up, do you want more? I always worry,
Yep.
Could we take a really good scar and make it not so good in the quest of getting just a little bit more hair? That's really good. One additional thing that Wendy brought up was that the fellow that came to get additional hair put in, and we looked at him with flash bulb lighting, indirect lighting at our picture area, and then with the lights off in the suture removal area to show what he really looks like in all different kinds of lighting. And his limitation is not the amount of hairs per square inch, but rather his fine hair, his color mismatch. And I told him very bluntly that I thought that the chances of me significantly improving his coverage and not changing his scar for the worse was about 0. And when he looked at the pictures and the video here in the office, he agreed with that. As I've stated many times, perfection in medicine is the enemy of good. You can easily take a guy like this who's gotten what I think is probably an A- result, limited by his hair traits, and turn him into a C by killing some of those hairs we put in and giving him a big doggone scar where we've got a good scar. So for all you guys out there who are greedy and want just a little bit more, recognize that there's no sure things, and it's often best to stop with a B+ or an A- rather than shoot for an A+. Certainly if you have a B- or a C, shooting for a B+ or an A is something that I would strongly encourage. Thanks.